Life or death: how to perform CPR when someone goes into cardiac arrest. A cardiac arrest is a fatal emergency, where acting fast could be the difference between life and death. Here we provide a step-by-step guide to performing CPR, with tips on how to administer it safely and efficiently. How to perform CPR, step-by-step guide. 1 in 5 adults don't, a worrying new study has revealed. And it's prompted the British Heart Foundation to urge everyone to learn CPR and basic first aid so they are better prepared. A cardiac arrest isn't the same as a heart attack, there are vital differences. Step 1: Shake and shout. First things first, check for danger and anything that could put you at risk. Gently shake the person who's unconscious and try to get them talking. If you're on your own, shout for help but don't leave the person. Step 2: Check breathing. A person suffering a cardiac arrest won't be breathing. Keeping their head back, check for signs they are breathing. They include regular chest movements, listening for breathing, feeling for breath against your cheek, look and listen for no more than 10 seconds. If you're not sure, assume they're not breathing. Open their airway by putting your hand on their forehead and gently tilting their head back. Lift the person's chin using 2 fingers of your other hand. If you're certain they're breathing, put them in the recovery position and dial 911. Step 3: Call 911. If someone isn't breathing, get someone nearby to dial 911. And ask if there's a public access defibrillator available. If there's no one to help, call 911, then start CPR. Step 4: Give 30 chest compressions. Kneel next to the person. Place the heel of one hand in the middle of their chest and your other hand on top, and interlock your fingers. Using straight arms, press down into the breastbone firmly and smoothly, so the chest is pressed down by 5 to 6 cms. Release and repeat at a rate of around 2 per second. Give 30 chest compressions. Step 5: 2 rescue breaths. Open the person's airway, tilt back their forehead and lift their chin. Pinch their nose. And take a normal breath, make a seal around their mouth and breathe out. You should see the person's chest rise and fall as you do it. Repeat twice. The 2 breaths should take no longer than 5 seconds. Step 6: Keep repeating 30 chest compressions and 2 rescue breaths until paramedics arrive. If you would rather not give rescue breaths, call 911 and continue with chest compressions. It's better than doing nothing. When should you perform CPR? A cardiac arrest happens when your heart suddenly stops pumping blood around the body, and will cause a person to drop down unconscious. You should act if the unconscious, unresponsive breathing irregularly. Dial 911, or get someone nearby to do it. The NHS say that when you call for an ambulance, telephone systems now exist that can give basic life-saving instructions, including advice about CPR. And, crucially, it's important to start CPR almost immediately, experts said. Simon Gillespie, chief executive of the BHF, said, CPR is the difference between life and death for thousands of people every year in the UK who suffer a cardiac arrest. Every second counts, and it simply isn't enough to hope that someone who knows CPR is present. We need everyone to learn this life-saving skill to give them the confidence to step in and give CPR when someone collapses after a cardiac arrest. Why is learning CPR important? The call for more people to learn CPR comes as survival rates for cardiac arrests that happen out of hospital are still worryingly low. Less than 1 in 10 people survive, the BHF warns. Every minute without CPR can reduce a person's chance of surviving a cardiac arrest by around 10%. So if CPR is taught more widely, it could help save thousands of lives every year. Joe Mulligan, head of first aid education at the British Red Cross, said, "We want all young people to feel confident and willing to help when faced with a first aid emergency. Learning first aid helps to increase confidence levels, and we believe it's a life skill everyone should have." Ultimately, the British Red Cross would like everyone to have the opportunity to learn first aid throughout their lives, starting at school, so that a generation of people can be equipped with the skills they need to help in an emergency. Our free teaching resources and workshops are designed to give young people the skills, confidence and willingness to act in an emergency. Sir Bruce Keogh, medical director for NHS England, said, "When 1 in 5 people witness someone collapsing who clearly needs CPR but the majority don't feel able to help, it's time to act." Teaching CPR to school children equips them with the knowledge that will ensure they can act in times of need. Empowering a young person with such a skill will allow them to take control in such a situation and possibly ultimately save a life. There are more than 30,000 out-of-hospital cardiac arrests across the UK every year, but less than 1 in 10 people survive. Mandatory training of all secondary school children in CPR would improve this rate of survival. The BHF's Call Push Rescue CPR training kit is free for eligible secondary schools in the UK. Thanks for watching and don't forget to subscribe to our channel.